Hi guys, and welcome back. So before we start, just a quick disclaimer. If there are any sensitive viewers watching or any children watching, this may not be the video for you. So today we're going to be discussing something that I see quite a lot and that a lot of my patients at my practice ask me about, and it's a little bit of a passion of mine. Today we are going to be discussing contraception. So first things first, what is contraception? Contraception is any method or device used to prevent pregnancy. Although not all methods and devices are as effective as one another, any form of contraception is better than no contraception. Before we move on to the rest of the topic, I would just like to also mention that I am currently doing my master's in sexology, so we're going to have some very interesting things to discuss in the future. Alright, moving back on to contraception. So before we start talking about contraception, I think it is very important that we understand how you fall pregnant. That way we can understand where and how the different contraceptive methods work. So I know we've all had this lecture at some point at school, so this is going to be a very basic, very quick refresher course. So basically, once a month, the female ovary produces a mature egg and releases this egg. It is then taken up by the fallopian tube. This is known as ovulation. You can only fall pregnant during ovulation. Ovulation usually starts 14 days after the start of your period and lasts 5 to 7 days. So when having unprotected sex during ovulation, the sperm then enters the vagina, goes through the womb opening, also known as the cervical os, enters the uterus, goes up the fallopian tube until it meets the mature egg. It then penetrates the mature egg. The egg is then fertilized. This fertilized egg then moves down the fallopian tube into the uterus and implants into the uterus. This is now pregnancy. So I have got a lot of patients that have a history of ectopic pregnancies. Also have a lot of patients that come into my practice presenting with an ectopic pregnancy. So I think it is important that we just discuss what goes wrong in this process to cause an ectopic pregnancy. So in this case, ectopic literally means outside of the uterus. So technically, an ectopic pregnancy can occur anywhere in the abdomen or pelvis as long as it is not in the uterus. I have once seen a patient that had an ectopic pregnancy that had implanted on her liver. This is an extremely rare case of ectopic pregnancy. Most ectopic pregnancies occur when the mature, fertilized egg fails to move down the fallopian tube and into the uterus and actually implants in the fallopian tube. This often presents as severe lower abdominal pain, usually more on the one side, vaginal bleeding, and a positive pregnancy test. This is an emergency. So if you do have an ectopic pregnancy, you will be taken to the operating room where they will remove either the entire tube or a portion of the tube as well as the pregnancy. Luckily, ectopic pregnancies don't usually develop very far because there is such limited space in the fallopian tube. So a lot of women in my country usually don't even know they were pregnant when they were diagnosed with an ectopic pregnancy. They usually come into the emergency room complaining of abdominal pain and bleeding in the vagina. So in some circumstances, the tube may actually burst. This is known as a ruptured ectopic pregnancy. This is even more of an emergency as you can bleed profusely. The good news is you only need one fallopian tube and one ovary to fall pregnant. Okay, so we veered a bit off topic, so going back to contraception. I've divided contraception into different groups, categories. A lot of doctors also use some of these categories. A lot of textbooks also use some of these categories. These are the categories that I have created in order to make it a bit easier for you guys to understand. So the categories that I have are barrier methods, hormonal methods, other, and emergency contraception. So the things that I'm going to discuss under other are coitus interruptus, or also known as the pull-out method. This method includes the male removing the penis completely from the female genitalia before ejaculation occurs. This then prevents the male from ejaculating into the vagina and therefore preventing pregnancy. This is obviously not a very effective method. Some of the reasons being, it is obviously a bit of a mood spoiler if you have to pull out in the middle of everything. Sometimes the excretions that are secreted from the penis before ejaculation, this is known as the pre-ejaculate, may contain sperm. Also, not all people use this method correctly, so it is very user dependent. The other 100% effective way for not falling pregnant is abstinence or not having sex at all. This is obviously not a very realistic option for a lot of people. The last method that I'm going to discuss under other is known as the rhythm method or the cycle method. So in this method, women actually time their period and count the days from when their period starts so that they know when they are ovulating, and then they either abstain during ovulation or not have sex during ovulation, or they use some other form of contraception during ovulation to prevent falling pregnant. This is obviously also not a very effective method because some women ovulate at different times. So although the textbooks say 14 days, some women ovulate on day 10, some women ovulate as late as day 20. So that's obviously going to be a problem with the rhythm method. Also, not all women's cycles are regular. So some women may have different ovulation times in different cycles. So that can be a problem, and that can be why this method is not so effective. Alright, moving on to barrier methods. So the reason why we call them barrier methods is literally because they cause a barrier between the sperm and the womb. Therefore, the sperm cannot penetrate the barrier, they cannot enter the uterus, and you cannot fall pregnant. So some of the less common barrier methods that were quite popular in the past that we do not use very often anymore are the diaphragm and the cervical cap. The more common barrier methods that are used today are the male and the female condom. The male condom is a long tube-like structure, usually made of latex. It is closed on the one end and has a reservoir at the one end. The male condom can also be made from other things that is now available in non-latex versions to help those patients that have got latex allergies. Very important, guys, a male condom must be put onto an erect penis, otherwise it will not be effective. The male condom also has the benefit, as well as other barrier methods, have the benefit that they help to prevent sexually transmitted diseases. Alright, so the male condom has undergone so many modifications that nowadays you get male condoms that are flavored, ribbed, studded, all kinds of weird and wonderful things. So the female condom is also a long tube-like structure, also closed at one end. It has a flexible ring on the one end that can be manipulated so that it can easily be inserted into the vagina. Guys, very important, when disposing of the condoms, please remove them carefully, tie a knot in the one end so that the fluids don't leak out, and dispose of them in an appropriate bin. No one wants to come into contact with your body fluids. Alright, so some of the disadvantages of barrier methods are, obviously it can be quite a dampener on the mood if you have to stop in the middle of everything to put on a condom. Secondly, it is very messy and sometimes a bit difficult to remove. And lastly, you always run the risk that any barrier method may tear or break. All barrier methods are more effective if used with a spermicide. So a spermicide is usually a gel or a foam that contains a substance that kills sperm when it comes into contact with it. Alright guys, so I'm going to stop the video here just to prevent it from getting too overwhelming and to get too boring or too long. I'm going to be discussing hormonal contraception and emergency contraception in the next video. So we'll do a part 2, possibly a part 3, because hormonal contraception can be quite long. Please guys, if you have any topics that you would like me to discuss in future videos, please drop me a comment. I hope this was informative. I hope you enjoyed it. I'll see you guys soon. Bye.